Doctor, if we read the back of many toothpaste that are available today in the grocery store, it says if we should swallow more than what you could fit on the end of the toothbrush, call poison control immediately. Perhaps you'd like to address that.
I haven't actually seen that myself, but of course I feel that way. I know that. Toothpaste is very toxic stuff. Not just because of the chemicals in it, but because the material in it is ground so fine that if you should get some into an extraction site where a tooth once was, it'll stay there forever. I find toothpaste in old extraction sites that never heal. They're called cavitations. I talk about that in the book. Cavitations where old tooth extractions have left an area of, well, minor infection. It becomes a bioaccumulation site, and there's toothpaste in there. There's a lot of silicone in toothpaste, and silicone is absorbed, taken in by the white blood cells, and white blood cells become disabled by it. Now, that's called low immunity, immune dysfunction. Coming from your toothpaste, that's awful.
Well, oddly enough, I was on the staff of UCLA back in the 60s, and I gave the first class at UCLA because one of my jobs at UCLA was to develop the curriculum for the new students coming aboard and also the dental school itself. And so I was fortunate to give the first lecture on mercury fillings that the students had. And in my research, I uncovered that mercury was a concern. In fact, in 1848, it was considered illegal to use mercury, unethical. The then union of dentistry was the American College of Dental Surgeons, and it was like the analogous to the ADA. And that group of bodies said it was illegal or unethical to use mercury because of its toxic concerns. But then there was no alternative that was able to be used. So dentists got together and began using mercury fillings because it was more economical. And indeed, there was a serious problem because what are you going to use? You can't use gold. Most people couldn't afford gold, and even the gold techniques were not refined as they are today. So there was no option, no alternative. So this group of dentists began to use mercury fillings, and that group grew and became the American Dental Association. So the American Dental Association has had its formation on the utilization of mercury fillings, which is ironic, of course.
The American Dental Association suggests that silver fillings really don't have any ill effect on our health, but you've proven that that is not true.
I wouldn't call them silver fillings. I would call them mercury, thallium, and lanthanide fillings because they are not made of silver and mercury and iron and nickel, let's say. They are made of silver, mercury, iron, nickel, and all the other 70 elements in the table, including the very toxic ones, including even uranium. We are finding uranium in them. How more carcinogenic can it get? And it gets out, that's the point. I think that the Dental Association is not aware, and hasn't done the experiments to find out, is not aware that the metals from these fillings, including uranium, can be found in the kidneys, the liver, the spleen, and other organs. Wherever your tumor is, that's where it's bioaccumulating.
There was a body of evidence that would say, hey, you're using this potentially lethal material while dentists were teaching, and I was one of the ones who were taught, who then taught that mercury was inert when you mixed with silver, tin, zinc, and copper, of which consists of the mercury filling or the amalgam or the silver filling. It's really a mercury filling because 50% of it's mercury. And if you mix it with silver, tin, zinc, and copper, we taught that it was inert, which is a scientific impossibility because everything by the laws of entropy is in the process of decay. And in the case of the dental mercury filling, the decay is quite prominent.
For those people watching this video that have already changed their tooth fillings from the mercury filling to the white fillings, what about that?
I have to apologize for that. That's what I said in the first book, Cure for All Cancers, that's what you should do. At that time, I was not aware that they were seeping carcinogenic dyes. I don't think any scientist anywhere could ever imagine that a perfectly white tooth, a white cap, should be tested for carcinogenic dyes that are red. But all the dyes are polluted with the other dyes. And all the materials that are used for the manufacture of these synthetic plastic teeth are polluted with synthetic dyes. We test for 18 azodyes. These azodyes cause the well-known P53 mutations.
And for those people that don't know what a P53 mutation is?
All tumors, cancerous tumors, are loaded with mutations. This means chromosome breaks and gene mutations. That's why you do a biopsy and send it to the lab. The cytologist in the lab looks at the slides, and when they see these mutations, chromosomes all over the place, they can designate what kind of cancer you have. That is the clue to the fact that there is cancer going on in that biopsy.
So your research has proven that a healthy cell is turning into a cancerous cell because of the dye.
Exactly. That's part of it. It's more complicated than that, but that is a very big part. And we cannot stop the tumor from growing, and we can't start it shrinking unless you stop giving it dyes, carcinogenic dyes.
In fact, in the average mouth, we might find sometimes 26 different metals in the mouth, which again not only is biocompatible problem with toxicities, but the electronics. This has been a fascinating field for us in the last 15 years. We've been doing electronic readings by using an amp meter, a more sophisticated digital amp meter. Well, if we have teeth now that have metal in their mouth that are constantly generating electricity, and by the way, our car battery is a lead pole and a zinc pole and a box of sulfuric acid, right? If we wanted to create the quintessential battery, we would use gold and silver, the cathode and the anode, the positive and the negative pole, which can create a wonderful battery. Well, we do this in the mouth. So tremendous amounts of electricity can disturb the normal flow of ionic flow in the body. So if you've got a constant flow of electricity created by the metal fillings in our mouth, we can then turn off, or the body says, hey, this stimulation is constant, I better do something to adapt. So it blocks instead of stimulates, like the initial acupuncture needle is stimulated, but if left in there could cause a problem. Our teeth are those bioelectrical electrodes, and I refer to them sometimes as spark plugs because they have capacity. The tooth, incidentally, the tooth is a very interesting device because it's surrounded by crystal. And the crystal, if we look at what the computer is all about, the computer has its heart in the silicone chip. It has the crystal of the silicone chip. And the analogous of the silicone chip in the computer is the enamel that covers this thing we call the tooth. So in a normal, healthy tooth, the tooth has capacity to hold a charge, like the spark plug has a capacity to hold a charge. But if you put metal in that tooth, you disturb this electronic flow. And so a whole vast of things are now being looked at related to this electrical disturbance that you make mention of, and rightly so.
As you can see in the X-ray, these teeth that are marked out are the ones that have silver fillings in them. Now they're as you can, we'll see just a bit in the mouth, they are decayed already. They start to leak, and these are full of bacteria. The bacteria starts to fester in his mouth, and then it'll start to spread all through his whole body. So what we have here is, you can see, some of the mercury and amount and some of the silver filling in there that is oxidizing and it's seeping into the body. And if we have micro leakage, want to see how far you can jump? Okay. Well, in this area there, he's already got some micro leakage, and Clostridium bacteria is going under there, and it festers in there, and that creates, well, an infectious site. And if you have bacteria in there, it'll start to go down into your tooth, and that'll go into your blood system, and then it'll harbor somewhere and create a larger problem.
Like a tumor.
It could go into a tumor.
Why are no other dentists doing this type of extraction procedure?
Well, from what I've talked with Dr. Clark, her theory is not, well, it's not a theory, her method is not well received by mainstream dentistry or mainstream medicine. There's a lot of things that are not well seen by mainstream medical practice.
Why do you guys see it that?
Well, the arguments that Dr. Clark told us were very convincing, and some of the things we have seen through her method are, well, they're very blatant. You can't really ignore them.
So you actually see the bacteria under the
Well, no,
tooth?
you don't see bacteria because bacteria is microscopic, but you see the benefits that it produces.
So you actually see patients getting well after the teeth are removed?
They're getting a lot better.
Well, we're talking in general today about controversial subjects, right? And certainly root canal fillings are extreme controversy. And there's been a lot of concerns about the root canal. And it's not just recent. Dr. Alfred Price really was one of the pioneers in the concern of root canals. He was a past president of the American Dental Association and a tremendous researcher and a humanitarian and a nutritionist. He said that basically what he had found in his early studies is that he would take an extracted root canal tooth and take some of that grindings and put it underneath the rabbit's ear, and he would find that if the patient, the donor from that tooth, let's say had a strep bacteria, that rabbit then would mimic or would develop the same kind of infection. So he found that there was bacteria present in a dead tooth living in the tubules themselves. A vital tooth, a healthy vital tooth, is made up of a canal on the inside with various blood vessels and nerves radiating inside the chamber of that tooth. And radiating from this canal are little tubules, microscopic little tubules in the dentin underneath this cap of enamel I mentioned earlier, that little tubules allow the fluid to come in and out of that tooth, balancing the hydrostatic pressure within that chamber, so that when there's swelling inside the tooth, we see a fluid coming out the tooth. Otherwise, we'd have a toothache all the time. So this exchange of fluids throughout the tubules in a healthy tooth is there for a reason. When we do a root canal filling, we take out all the canal, all the dead tissue. In the case of a dead tooth, we were to assume that if a tooth died, we would simply remove the nerves and the blood vessels and the abscess and all the dead tissue that was related to a dead tooth and fill it in with a suitable filling material. Now, assuming that filling material is suitable, Dr. Price showed that within these tubules that were once occupied by fluid, now they have become dehydrated, and then they become inhabited by microorganisms.
Why do you have to extract a root canal?
Because wherever there is foreign material in a tooth socket, which is way down deep in your tissue, Clostridium bacteria find that location and they grow there. So it isn't, in this case, a matter of what the composition is. It's the fact that it gets infected and you don't know it. You don't feel pain. You're not alerted to it. And the Clostridium bacteria find it a home because it's anaerobic.
What's the problem when people extract the teeth and they don't pull that ligament out?
Well, according to Dr. Clark, everything in this area has already been infected. And if you leave part of the tissue that's infected, it'll still fester in there. It'll still be contaminated. The reason for this is that although you do get a lot of bleeding, the bone in that area is not as, well, it doesn't have as much circulation because it's a thicker type of bone. It's more of a cortical type of bone that goes into that area. Now, this cortical bone is thicker, it's denser, so it has less circulation. And unless that is scraped off accordingly, and some of that bone that seems to be contaminated, taken out, so we leave a nice big bloody mess.
An open cavity so it can heal better.
So it'll heal better.
And this is what she calls the Archega method in her new book.
I haven't read her new book yet.
Look at that, Chris.
This is the top part. This is the bottom here.
Look at that bacteria.
Is it black?
All that black. There's
You know
what.
the feeling, see that?
Gosh, look how poisonous that is.
Wow. Keep it over there.
I put your mouth pieces of gas.
I'll do
When
that.
you like.
Okay. I'm now 37 years old, and I've had these fillings since I was 13, and I've constantly been fighting with an immune system breakdown, and I've always had little growths growing in my lymph system, and most recently I've had this tumor on my breast, and I couldn't get it to go away, constantly fighting with bacteria growing there, specifically the Clostridium. So after consulting with Dr. Clark, she said the only thing to do is to really pull the teeth. The fillings were so big that I couldn't risk trying to drill them out and poison myself with even the slightest amount of the mercury. And now that we can see what actually came out, it was even more toxic than we thought. And to be honest with you, I think this procedure was actually easier than going in with a drill and drilling and trying to replace the filling. And to date, there really isn't anything to replace the fillings with that isn't toxic. So for the sake of saving my life, I think this was a much better procedure. And I'll just get some partials and put them back there and continue on with my healthy lifestyle.
So all this research that you've done over this past number of years, you funded yourself?
Yes.
And in doing so, how were you compensated?
By the knowledge, I suppose.
So you do this out of the goodness of your heart, not looking for compensation financially, but you have a true passion for finding the cure to all disease.
Well, at least cancer and AIDS.
Again,
I can't cope with all the rest of it. Others will, now that we have a technology that can do it. But I thought that I should be focused on cancer and AIDS since there is so much suffering there.